The leading cause of preventable death is cigarette smoking. According to the CDC 2016, smoking accounts for 480,000 deaths annually, which can also be seen as 1 in 5. In 2015, about 15% or 36.5 million U.S. adults smoked, and of those, 16% have a smoking-related disease. Smoking negatively impacts nearly all organs and is linked to cancer, heart disease, lung disease, and birth defects. The rates of smoking currently are the highest among adults with a graduate education degree certificate, GED. 34.1% of that population smokes, and the lowest with a graduate degree, 3.6% with a graduate degree currently smoke, CDC 2016. Approximately $289 billion are spent annually on smoking, $132 billion on medical care, and $157 billion in productivity loss secondary to illness and death of smokers. This is a map indicating rates of smoking across the states. California and Utah have the lowest rates of smoking, and Kentucky, Arkansas, and West Virginia have the highest rates. California has been a front-runner as the first state to enforce a ban on public smoking and smoking in indoor workplaces, and to tax cigarettes, NAMOND 2011. Prior to the first Surgeon General's report linking smoking to lung cancer and heart disease in 1964, the dangers of smoking were not in the public's eye. The report is said to have laid the groundwork for programs of today aimed to decrease the prevalence of disease and death from smoking, U.S. Department of Health and Human Services, 2014. After this occurred, the tobacco industry and cigarette companies have refined the cigarette, leading to even more addictive product. The new product would lead to more efficient and rapid absorption of nicotine, yielding a more addictive cigarette. Cigarettes are thought to be more addictive currently than they were in prior years. Changes in advertising have shown improvements in the reduction of cigarette sales. The ad on the left is from the 30s. By having doctors in the ads, the motive was to convince the public that smoking wasn't harmful. The image on the right is from the American Cancer Society's Nasty Effects campaign, which started in 1964, and represents more blatantly the harmfulness of smoking. Increasing the price of tobacco has shown to increase the number of people quitting. By increasing the cost of cigarettes, by 2015, an economic review showed an overall healthcare savings of 14 cents to $90.02 per year, and a review of the overall savings in a nationwide smoke-free policy would account for $700 to $1,297 annual reduction per person, CDC 2017. Lower rates of smoking increased sensation and decreased numbers of young people starting to smoke, and were linked to mass media campaigns in which large numbers were reached. Restrictions on marketing have not been effective in improving the issue. They have caused the tobacco companies to be more creative with their marketing techniques by improving packaging and fonts, by increasing in-store advertising, and by increasing the youth's awareness of the psychological benefits of smoking. Pierce, White, and Emery, 2011. Quality indicators used to measure outcomes include a reduction in prevalence of active smokers, reduction of smoking-related disease, and a reduction of smoking-related hospital visits. It was estimated that 17.7 million Americans have died from smoking-related complications since 1964. This number would have been an estimated 8 million higher in the absence of tobacco control, Knox, 2014. This graph identifies a reduction in cigarette consumption and smoking and health events from 1900 to 2012. As you review the graph, you can see that per capita consumption decreases after reports on smoking and health and secondhand smoke are broadcast. The prevalence of smoking declined from 21% in 2005 to 15% in 2015. Health policy can be used to improve the smoking problem by producing a vision for a smoke-free future. Decisions made now can help to achieve the goal by identifying long-term benefits, including personal health, a reduction of preventable disease and death, and overall healthcare savings resulting from the change. Accessible and affordable quit smoking treatments have been effective, and by giving everyone access to the programs, the opportunity for quitting is more prevalent. By identifying the facts and providing information to the public, consensus is reached and decisions for change are made. From the Congressional Committee, I am requesting that Congress take action on prevention of new smokers and increasing smoking cessation. Research has shown that increasing the cost of cigarettes, enforcing smoke-free laws in public places have proven effective in decreasing smoking rates and decreasing the amount of exposure non-smokers are subject to. I'm requesting an increase in cigarette tax. The taxes would be spent on mass media campaigns to raise awareness and expose the dangers of smoking in a more blatant way. I'm asking that an increase in budgeting for focus on creating more public smoke-free spaces, a both local and nationwide effort, be implemented. I am asking for a ban on both advertising and promotion of tobacco products.